Welcome back to Midday Kentucky, everyone. Well, Dr. Perry Williams, the chiropractic and sports performance over there at Winchester Chiropractic. Hey, welcome back to the show, buddy.
Good to see you guys.
A lot of people really loved last time you were on. You had almost 7,000 views.
I know.
Wow.
Yeah.
Video.
There you go.
It's a bit popular.
Kind of a big deal.
He's a kind of a big deal.
I'm not as famous as you guys, but I mean, you know.
You're getting there.
Yeah,
You're getting there.
One day at a time.
Look, I want to talk to you a little bit about, a lot of conversation is out there about chiropractors, I should say. People seem to think it's just about the back.
Yeah.
And that's why we've got Eric here today, and we're going to talk a little bit about other aspects of the body that you're great at looking after.
Well, and that's exactly right. We really get kind of labeled as that neck and back and spine, and that's true. But I think a lot of people don't think of what we call extremities, which are shoulders, elbows, wrists, hands, feet, all that, even jaws, believe it or not. We'll get referrals from dentists for other things and for TMJ problems. And
for jaws?
Just, you would believe, yeah. And a lot of people don't know that. And so that's one of the things that I thought, I was thinking about, what do I tell you guys and stuff? But I think that's something that could potentially help a lot of people.
Okay, so let's just have a little bit of a demonstration on Eric when you're talking about the shoulder in particular.
Okay. And so what we'll start with here, if you can see this is a shoulder, an anatomically correct right shoulder. And what we typically see in...
It looks as bony as
it's right. The most common, you can tell it's not mine. Yeah, that's right. So what we normally see is an internal rotation of this, and then there's a correction subsequently for that. So that's the most common thing that we see, is where because of our texting and we're forward and our head's down and we're mouse and computer and desk and everything, so we have a tendency to be overly tight in the front and then either loose or not strong enough in the back. So we'll make a mechanical correction and then also some correctives for the correction, which would be exercise, stretching, or whatnot.
Okay, so give us an example of how that would look and what someone would expect when they're coming in. So just talk us through that, if you wouldn't mind.
Yeah, so as a general rule, this is assuming we've done the exam and everything else that we've done. And so what we do is just like some gentle movement to see exactly which way functionally this thing may be fixated. And so from there, again, the most common is a correction that's done this way. So what happens is our line of correction, which what we're going to call, is we're trying to bring this fixation this way and then externally rotate this way. Because what we're trying to do is simulate what's happening with the rotator cuff. Right. And so as a general rule, it's going to overstretch, which is going to overly internally rotate. So we want to bring that thing kind of back around this way. So the set actually is just going to be nice and easy. Right. Just like that. Okay. And literally no more than that. Like, he's fine, or it would have set just then. It's so gentle and so easy.
I'm interested, just show me the shoulder, and then you were talking about the shoulder and the elbow, I should say.
So another common area that we see is this radius and the radial head out to the lateral aspect. So one thing that we do here, and again, there's different ways of doing it, but a very common reduction of this is sometimes that's brought in a full extension, which I actually don't like because I think it's a little more discomfort. So what we can do is actually internally rotate this and then bring it this way and set just like that. Okay. We can also do it the opposite direction. Bring it on down to the wrist. Common problems people have, mouse, the computer mouse rather, texting, these kinds of things. Commonly we'll see lunates, scaphoids, bones in the wrist that we can just set. Boom, just like that.
Just really, like that.
Really no more than what we just showed there.
Take a seat again. We really appreciate that, because I find it fascinating, because I've now become a patient after last time you were on, and I love coming over not only for acupuncture now, but also being manipulated as well. Eric, you were saying that when you have back problems, sometimes you're not quite sure what you need to do about it.
That's right, and I feel like the back is kind of one of those things where people just kind of wait, saying, "Well, I'll wake up one day and it'll kind of go away." When do you actually need to act on it?
So that's a great question. Normally what we find is, I tell my folks, think about it like if I'm raking leaves. If I'm raking leaves and I get a little tweak here, I lift weights and my biceps a little sore, 7 to 10 days, that stuff's going to go away. As a general rule, if it's just a nice, easy, simple little thing, let it clear up on its own. You don't have to rush in every little bitty time. But if after 7 to 10 days you're still having some issues, you need a primary care doctor, see physical therapist, see your chiropractor, see whomever is going to specialize. Of course, I'm a chiropractor, so we're going to say that. But at the end of the day, if it's not cleared up in 7 to 10 days, you really should have it looked at.
I just wanted to quickly touch. I thought that was a really important question, because that is things that people do put off. You take all sorts of insurance.
Yes.
I love that you guys do that.
Yeah, almost. If it's out there, we take it, especially in Clark County and Winchester. We're one of the only ones that take that. Many of them, whether it's the Medicares and Medicaids and all the Anthem Blue Cross.
What's
all
that
this stuff.
bed I lay on, and it does this thing before I come in to see you very quickly?
Yeah, it's an intersegmental traction table, so it's kind of like a foam roller for a lazy person.
Oh, beautiful.
I don't mean you.
Right up his alley. Right up his alley.
If you want to see this bloke, I'm telling you, he's a fantastic chiropractor, everyone. And I feel amazing. There's all his information up there right now, 859-737-5800. And I have to say, last week I went over for acupuncture after we did that story on GDK. Amazing.
Yeah,
I
she's
cannot
great.
tell you how, I've forgotten her name again.
Fawn.
Fawn,
Rangel.
absolutely
Yeah.
gorgeous. So give them a call, everyone. Thanks for coming in. Thanks for being
Thank
our
you.
model. You're going to meet Fawn in a few weeks. We're doing cupping on you.
Oh, that's right.
Live on camera.
The shirt's
Hey,
coming
stick
off,
with us,
people.
everyone. We'll be right back after this short break.